first stages of a pandemic. Protect the greatest possible number of Americans during the pandemic. The cornerstone of our strategy is to develop new technologies that will allow us to produce new vaccines rapidly. If a pandemic strikes, our country must have a surge capacity in place that will allow us to bring a new vaccine online quickly and manufacture enough to immunize every American against the pandemic strain. Recently met with leaders of the vaccine industry. They assured me that they will work with the federal government to expand the vaccine industry so that our country is better prepared for any pandemic. Today, the NIH is working with vaccine makers to develop new cell culture techniques that will help us bring a pandemic flu vaccine to the American people faster in the event of an outbreak. Right now, most vaccines are still produced with 1950s technology, using chicken eggs that are infected with the influenza virus and then used to develop and produce vaccines. In the event of a pandemic, this antiquated process would take many months to produce a vaccine, and it would not allow us to produce enough vaccine for every American in time. As American lives depend on rapid advances in vaccine production technology, we must fund a crash program to help our best scientists bring the next generation of technology online rapidly. I'm asking Congress for $2.8 billion to accelerate development of cell culture technology. By bringing cell culture technology from the research laboratory into the production line, we should be able to produce enough vaccine for every American within 6 months of the start of the pandemic. I'm also asking Congress to remove one of the greatest obstacles to domestic vaccine production, the growing burden of litigation. In the past 3 decades, the number of vaccine manufacturers in America has plummeted as the industry has been flooded with lawsuits. Today, there's only one manufacturer in the United States that can produce influenza vaccine. That leaves our nation vulnerable in the event of a pandemic. We must increase the number of vaccine manufacturers in our country and improve our domestic production capacity, so Congress must pass liability protection for the makers of life-saving vaccines. By making wise investments in technology and breaking down barriers to vaccine production, we're working toward a clear goal. In the event of a pandemic, we must have enough vaccine for every American. The third part of our strategy is to ensure that we are ready to respond to a pandemic outbreak. A pandemic is unlike other natural disasters. Outbreaks can happen simultaneously in hundreds or even thousands of locations at the same time. And unlike storms or floods, which strike in an instant and then recede, a pandemic can continue spreading destruction in repeated ways that can last for a year or more. To respond to a pandemic, we must have emergency plans in place in all 50 states, every local community. We must ensure that all levels of government are ready to act to contain an outbreak. We must be able to deliver vaccines and other treatments to frontline responders and at-risk populations. So my administration is working with public health officials and the medical community to develop effective pandemic emergency plans. We're working at the federal level. We're looking at ways and options to coordinate our response with state and local leaders. I've asked Mike Levitt, Secretary Levitt, to bring together state and local public health officials from across the nation to discuss their plans for a pandemic and to help them improve pandemic planning at the community level. I'm asking Congress to provide $583 million for pandemic preparedness, including $100 million to help states complete and exercise their pandemic plans now before a pandemic strikes. If an influenza pandemic strikes, every nation, every state in this union, and every community in these states must be ready. To respond to a pandemic, we need medical personnel and adequate supplies of equipment. In a pandemic, everything from syringes to hospital beds, respirators, masks, and protective equipment would be in short supply. So the federal government is stockpiling critical supplies in locations across America as part of the Strategic National Stockpile. The Department of Health and Human Services is helping states create rosters of medical personnel who are willing to help alleviate local shortfalls during a pandemic. And every federal department involved in health care is expanding plans to ensure that all federal medical facilities, personnel, and response capabilities are available to support local communities in the event of a pandemic crisis. To respond to a pandemic, the American people need to have information to protect themselves and others. In a pandemic, an infection carried by one person can be transmitted to many other people. And so every American must take personal responsibility